Picture this. You are out for a run, maybe, pushing yourself a little harder than usual. Or perhaps you are just stepping off a curb awkwardly while you're checking your phone, and suddenly you roll your ankle.
Oh, yeah. We have all been there. It is the worst.
Right, you feel that sharp, undeniable tweak. Or maybe you just finished an absolutely grueling lower body workout. The kind where your hamstrings are just screaming at you the very second you stop moving.
Oh, absolutely.
So what is the very first thing you do when you get home? You probably hobble into the kitchen, open the freezer, and just reach straight for an ice pack. I mean, it is an automatic reflex.
It really is.
You slap that frozen bag of peas right onto the skin, you feel that numbing relief, and you think to yourself, well, okay, the healing process has finally begun.
Yeah, we totally treat that chilling sensation as the definitive first step of recovery. I mean, we have been taught from a very young age to expect that ice will, stop the swelling, kill the pain, and somehow just jumpstart the repair of the tissue.
But what if everything we have been conditioned to believe about that ice pack is completely backward? We are jumping into a deep dive on some fascinating research today, and the premise is genuinely startling.
It is a huge paradigm shift.
It really is.
Mhm.
According to a recent study conducted by a research team at McGill University, that ice pack you rely on to reduce pain and swelling might actually be doubling your recovery time. And incredibly, it might be dragging out your pain for much longer than if you had just, done nothing at all.
Exactly. The researchers are essentially arguing that the very thing providing you with that short-term relief is actively sabotaging your long-term healing. So we really have to completely unlearn what we think we know about inflammation and how the body recovers from physical trauma.
Which is wild. So our mission for this deep dive is to deconstruct the science behind this counterintuitive finding. We are going to explore this biological paradox of short-term relief versus long-term healing and really figure out why the standard medical advice we have followed for decades is suddenly under the microscope.
And as we go through this, it is so important to keep an open mind. Because, like you said, this research challenges our most fundamental assumptions about injury recovery.
Right. So to understand why this McGill study is so groundbreaking, we first have to look at the deeply entrenched behavior it is actually challenging. For decades, the unquestioned pillar of injury management has been the RICE-E protocol, right? Rest, ice, compression, and elevation.
Yeah, it is universally applied across the globe.
Right.
Like in French-speaking medical communities, they use the acronym GREC, which is glacé, repos, elevation, compression. But it's the exact same concept.
It's everywhere.
It is. Whether you are dealing with a school nurse handing out ice in the cafeteria, or a weekend warrior, a professional athletic trainer, or even a healthcare professional in a clinical setting, this is the default, undisputed approach.
Okay, let's unpack this, though, because I have to push back a little. If elite athletes, people with literally million-dollar bodies, and top doctors have been using the RICE protocol for years, how could it possibly be wrong? I mean, doesn't excessive swelling physically prevent a joint from moving and delay healing?
You are hitting on the exact confusion that has driven sports medicine for basically 50 years. There is a massive difference between managing catastrophic, limb-threatening swelling and managing the natural, localized swelling of just a routine injury.
Okay, that makes sense.
What the data reveals is this huge gap between widespread practice and actual long-term scientific evidence. So the core of the RICE protocol, specifically the ice part, or cryotherapy, is incredibly effective at numbing the area.
Right, makes it feel better.
Exactly. Makes the pain go away temporarily.
Right.
But the medical community collectively conflated that temporary symptom masking with actual structural healing.
Okay, so think of it like this. Applying ice to a sprained ankle is essentially like hitting the snooze button on a blaring fire alarm.
Oh, that is a great analogy.
Right, because it stops the incredibly annoying noise immediately, which is great because the noise is the pain. You get some peace and quiet. But hitting the snooze button does absolutely nothing to put out the actual fire burning in the hallway.
It is actually worse than just hitting snooze, to be honest.
Yeah.
You're basically locking the fire doors so the firefighters cannot even get into the building. The researchers point out that despite the massive global popularity of icing injuries, the actual scientific data proving any long-term benefits of this protocol is surprisingly limited.
Wait, really? The data isn't there?
No, it is very sparse. We basically relied on an assumption. We assumed that because the joint felt better in the moment, the underlying cellular damage is naturally being repaired.
Wow. Okay, so if the ice isn't actually helping us heal, what exactly is it doing to our bodies on a cellular level? Because clearly it is doing something dramatic to make the joint look and feel so different.
Well, let's look at the biology. Lucas Lima, he is the lead author of the study and a research associate at the Allen Edwards Center for Research on Pain at McGill University. He describes this dynamic as a biological paradox
A paradox. How so?
because the very treatments that are highly effective at reducing inflammation actively hinder the essential biological processes that are absolutely required for your body to achieve a complete recovery.
Okay, here is where it gets really interesting. Let's break down that mechanism. Because when tissue tears, your body immediately triggers a response, right?
Yes. So when you roll your ankle, you tear microfibers in your ligaments and muscles. The body immediately initiates vasodilation. It opens up the blood vessels around the injury as wide as possible.
And that is what causes the redness and the heat.
Exactly. It is opening up a biological superhighway, so to speak, so it can rush blood, immune cells, and inflammatory markers right to the site. First responders, like neutrophils, arrive to clear out any potential bacteria. And then macrophages swoop in to literally eat the dead, damaged tissue through a process called phagocytosis. They're essentially clearing the site so new tissue can be built.
Okay, I love visualizing this. Imagine inflammation is like a noisy road construction crew. They show up with jackhammers and heavy machinery to fix a giant pothole in the street, which in this case is your torn ligament.
Right.
It is loud, it disrupts traffic, it is highly irritating. That is the throbbing pain and the swelling you feel in your ankle.
And then you grab an ice pack. Applying that extreme cold causes massive vasoconstriction. The blood vessels clamp shut immediately.
So you are basically using a freeze ray on that entire construction crew. The annoying noise stops right away. The street is suddenly quiet. You feel this profound relief. But because all those construction workers are now frozen solidly in place and the highway is shut down, the pothole never actually gets repaired.
Exactly. The dead tissue just sits there.
The necessary work has been completely halted.
Yeah, by artificially shutting that process down with cryotherapy, you are stopping the rebuilding phase before it can even really begin. You are trapping all that cellular debris in the joint.
Oh, wow.
And the study explicitly notes that by doing this, you risk doubling the time it takes to fully recover. By trying to rush the relief, you are doubling the duration of the injury itself.
Taking a 1-week injury and turning it into a 2-week injury simply because you couldn't tolerate the initial noise of the construction crew, I mean, that is staggering.
It really makes you rethink everything.
It does. But, if physically blocking inflammation with an ice pack is this problematic, it begs the question, what about the other ways we fight inflammation? Because ice isn't the only tool in the cabinet. People pop over-the-counter anti-inflammatories like candy after a hard workout.
Oh, absolutely.
Yeah.
And the McGill study doesn't exist in a vacuum here. It actually adds to a steadily growing body of research that is actively questioning the long-term benefits of almost all common anti-inflammatory strategies.
So it's not just about a...
No, not at all. The research highlights previous studies showing that common medications, like aspirin, ethylsalicylic acid, can also prolong pain. And furthermore, previous animal studies have already indicated that applying ice delays physical tissue repair.
Wait, let me stop you there. If past animal studies already showed that ice delays tissue repair, what makes this new McGill study so special? Why is this the one making headlines?
What is fascinating here is the specific breakthrough regarding the nature and duration of the pain itself. So for the very first time, using evidence from experiments on mice, researchers showed that icing affects not just the physical repair of the tissue under a microscope, but the actual lingering sensation of pain.
Wait, really? So it's not just that the muscle takes longer to knit back together, it's that the physical feeling of pain actually drags on for a longer period of time.
Yes, exactly. The researchers took these mice and simulated two types of injuries. They did inflammatory injuries and injuries related to physical exercise, and then they applied cryotherapy. They didn't just measure the cellular regeneration, they measured the pain responses. And the mice that received the ice treatment experienced pain for a significantly longer duration than the mice whose bodies were allowed to just undergo the natural, uninterrupted inflammatory process.
Man, so if you are the one sitting on the couch with a frozen bag of peas on your knee, you are literally buying yourself an afternoon of pleasant numbness in exchange for a month of a nagging, aching joint.
It is a terrible trade-off when you look at it like that.
You are trading a few days of intense, acute pain for weeks of lingering, chronic aching.
Yeah, you are fundamentally altering the natural trajectory of the biological response.
Yeah.
The body knows exactly how to heal itself, but it absolutely requires that initial, intense burst of inflammation to set the stage. When we interfere with that burst, we disrupt the entire timeline.
And so the nervous system just continues to signal distress long after the acute phase should have ended. Okay, so bringing this back to the human element. Mice are great for gathering lab data, obviously. But a mouse doesn't have a 9 to 5 job, or a mortgage to pay, or a soccer tournament on Saturday. Has anyone actually tested this dynamic on human patients yet?
Well, that is the essential next step. This push to translate the data to humans is being championed by Jeffrey Mogul. He is the senior author of the study, a James McGill Distinguished Professor, and the E.P. Taylor Chair in Pain Studies.
Okay.
He stresses that these findings demand a much better, much more nuanced evaluation of exactly when anti-inflammatory strategies are useful and when they are actively counterproductive. So it is no longer just a blanket ice everything immediately scenario. However, he provides a crucial caveat.
Which is?
These results, as compelling as they are in the lab, are not yet directly translatable to human beings.
Right. So what does this all mean for you, the listener? Should you go empty your freezer of ice packs right now and just suffer through the swelling next time you twist your knee?
I would strongly caution against extreme reactions like that. The takeaway is not necessarily to never ever use ice under any circumstances, but rather clinical trials are actually currently underway to see if this exact same effect, the prolonged pain and delayed healing, actually occurs in humans.
How are they testing that? I mean, they aren't bringing perfectly healthy people into a lab and spraining their ankles on purpose, right?
No, thankfully not. They are observing patients who are naturally in a state of recovery from specific medical interventions. Specifically, the researchers are tracking patients who are recovering from having their wisdom teeth extracted.
Oh, wow. That is the perfect real-world model. I mean, everyone gets their wisdom teeth out, the trauma to the mouth is significant, your cheeks swell up like a chipmunk, and the absolute first thing the oral surgeon hands you is a strap-on ice pack for your jaw.
It really is the ideal scenario to study acute inflammation and standard cryotherapy treatment in humans. By tracking these patients, the researchers basically hope to see if the humans who diligently use the ice packs experience a longer overall duration of lingering jaw pain compared to those who simply let the facial swelling run its natural, albeit uncomfortable, course.
So if you get your wisdom teeth out anytime soon, you are essentially experiencing the real-time test of this theory. But until those human trials are published, how should we be thinking about our own injuries?
The current call to action from the researchers is simply to critically question our automatic reflexes. When you get injured, don't just blindly reach for the ice because it is what you have always done or because, a gym teacher told you to do it 20 years ago.
Right. We need to start viewing inflammation not as a disease to be cured, but as a deeply evolved biological mechanism to be respected.
Exactly.
So let's quickly recap the journey of this deep dive. We started by exploring how the beloved Rice protocol, despite being universally prescribed, actually lacks robust long-term data. Then we unpacked the biological paradox, where short-term pain relief actively sabotages biological healing, freezing the construction crew in place. And finally, we looked at how mouse studies showing prolonged pain duration are paving the way for these upcoming human clinical trials on wisdom teeth.
That sums it up perfectly. It is a massive paradigm shift. We have spent decades aggressively fighting our body's own first responders. Whether it is a bag of frozen peas or an over-the-counter pill blocking chemical signals, we have kind of been getting in our own way.
And it leaves you with a really compelling, provocative thought to ponder. The researchers highlighted that we desperately need to evaluate when these anti-inflammatory strategies are actually useful. But think about the very human reality of living with pain.
Oh, yeah.
If these upcoming clinical trials on wisdom teeth definitively prove that ice delays physical healing, but provides immediate, profound mental and physical relief from agonizing pain in the short term, how do you weigh those two outcomes?
That is the million-dollar question. It comes down to prioritizing your personal health goals in that specific moment.
Exactly. At what point does the psychological comfort of masking the pain today outweigh the cost of a delayed physical recovery tomorrow? I mean, if you have a massive presentation at work, or you just need to be able to sleep through the night without throbbing agony, maybe you decide you need to hit that snooze button on the fire alarm just to get through the day.
Right, even knowing it means the pothole takes longer to fix later.
Exactly. It challenges you to look inward and ask, is your priority in that moment to simply feel better right now? Or is it to truly fully heal for the future? So the next time you tweak a muscle and find yourself limping toward the kitchen, you might just look at that freezer door in a whole new light.